Swiss national health authorities are suddenly backing off from recommending the COVID-19 vaccination, going so far as to not even recommend the shots for their vulnerable population. Whatever do you think is happening here? We're going to discuss. Meanwhile, in case you didn't notice, here in the US, our government quietly and without any fanfare ended the national emergency surrounding the pandemic. Didn't notice? Well, you're not alone. We're going to be discussing this as well. And so, from Trial Site News, I am Adrian, and our episode is starting right now. So, recently several groups and individual Substack users critical of the COVID-19 vaccines have declared that Switzerland has banned COVID-19 vaccines. Now, while this isn't necessarily the case, at least not yet, the Switzerland's federal health agency known as BAG did in fact make material changes to their national vaccination schedule. The agency has backed away from recommending COVID-19 vaccination for their spring and summer. Now, this, of course, is their off-season for respiratory viruses, which could be part of the explanation, but what else do you suppose could be the reason behind this sudden shift in attitude towards the COVID-19 vaccines? Now, unsurprisingly, this sudden shift by the Swiss government has been almost entirely ignored by the mainstream news press here in North America, possibly because it doesn't fit the current narrative on this side of the pond. In any case, as I mentioned, BAG has withdrawn any COVID-19 recommendation for the spring and summer of 2023. However, the agency does remain open for COVID-19 vaccine assessment for at-risk individuals, meaning the elderly or people with comorbidities and those with immunosuppressed conditions. In their decision, the agency noted that a majority of the population has already been vaccinated, emphasizing the implicit message that the COVID-19 vaccine products contribute some protection against the Omicron-based variants. However, BAG also conveyed that many of their citizens have also already been infected with COVID-19, acknowledging that natural immunity may in fact potentially be superior to the vaccination itself. They also couch this by acknowledging that the overall Omicron pathogen has become far less acute. And on that note, we here at Trial Site News have also recently reported on one study in China covering the BA.5 Omicron subvariant, where they found that over 90% of the study participants infected with the SARS-CoV-2 Omicron were asymptomatic. This means no symptoms. Now that's interesting. Of course, and there is an of course to this, come the colder seasons later in 2023, the health agency BAG said that they will reevaluate their recommendations. So is BAG recommending the COVID-19 vaccine for particularly vulnerable people? Well, the shorter answer to this is no. In what could be seen as a surprise move from the North American perspective, the Swiss National Health Authority is backing off any recommendations for the COVID-19 vaccine. Clearly, the agency has concerns that they are not overtly sharing with the public. Could it be that there's a growing concern of side effects associated with the vaccine, or perhaps it's something else? Hopefully we get to the bottom of that. Anyway, BAG recommends that if individuals seek a COVID-19 vaccine, they can consult with their physicians as, quote, vaccination can be useful in individual cases because it improves protection against serious illness for several months. So what cohorts face materially greater risk against COVID-19, according to the health agency BAG? Well, according to the agency, they include individuals aged 65 and up, people aged 16 and over with chronic illness, people aged 16 and over with trisomy 21, and pregnant women. Now, what if the COVID-19 wave surges? Well, if that happens, then the Swiss National Authority will reconsider its current recommendations. Now, what about the agency's recommended timing of shots? Well, it still stays at 6 months after the last vaccination or half a year from the last known infection involving SARS-CoV-2. Now, if you were to get vaccinated, what vaccines does BAG prefer? Well, they prefer either the bivalent mRNA vaccine, acknowledging the monovalent vaccine effectiveness has markedly waned, or the Novavax protein vaccine. Now, interestingly, the agency is still highlighting what they believe is the importance of mRNA vaccination for pregnant and breastfeeding women. Now, what about the cost of vaccination in Switzerland? Will it be free? Well, my friends, because the Swiss government is no longer recommending the shots, individuals who want to get vaccinated must cover their own costs for COVID-19 vaccines. One caveat to this, though, is the policy does change with at-risk people. Compulsory health insurance covers these shots for vulnerable populations. And finally, as I briefly touched on earlier, what about the chatter online that the Swiss authorities have pulled all mRNA COVID-19 vaccines? Again, this is not really the case. Clearly, the agency has recalculated the risk-benefit analysis, the liabilities and the like, but remains quite open to reconsidering if COVID-19 surges again. Now, all of this is quite interesting, and I find the fact that the North American media not covering this is quite telling about the confluence of material interests converging on big media. Now, this then brings us right along to the second half of this episode, where more specifically we're going to talk about the official ending of the pandemic national emergency. You see, back on Monday, April 10th of 2023, President Biden signed into law H.J.Res 7, which terminated the national emergency related to the COVID-19 pandemic. He signed this edict a month earlier than anticipated, and over 3 years since this whole mess began. You see, for the past 3 years, this law has afforded greater power to the executive branch to direct, marshal, and use funds to counter the viral threat. And naturally, this power has been abused because, of course, it has. Remember the attempt by the current administration to use this emergency as a way to forgive student debt? I sure do. Now, interestingly, in a world of 24/7 news cycles and constant chatter on social media, this critical legislation was executed with little notice and no fanfare as Biden signed it into law, terminating the national emergency triggered by the SARS-CoV-2 pandemic. The White House issued a short one-line statement on the matter, saying that on Monday, April 10th, 2023, the president signed into law H.J.Res 7, which terminates the national emergency related to the COVID-19 pandemic. Biden signed this measure behind closed doors, this after having publicly opposed the resolution at one point. And it is also worth noting that 197 Democrats in the House voted against this measure when the GOP-led House passed it back in February. And then in March, the Senate passed the legislation 68-23. So here we are. The national emergency ending has implications for an entanglement of laws and policies, from immigration to student debt forgiveness. We are 3 years after this pandemic emergency was declared, and over 1 million people have been reported as having died during the COVID-19 pandemic, although it should be noted that that number remains in doubt, as it has become known that a substantial number of deaths may have been recorded as due to COVID-19, when in fact the actual cause of death may have been another condition. This has been a remarkably tragic period in American history. The American people have allowed themselves, by and large, to be coerced into endless lockdowns, and many willingly gave up their freedoms for the greater good, you see. By January of 2023, the U.S. government has spent over $4.6 trillion in response to the pandemic. And these expenses have been considered by many as a vast transfer of wealth over the past 3 years from the public treasury to a myriad of societal interests, including Big Pharma, and payments to the unemployed. And the question should be asked, what precisely did we, the American people, get out of all of this? Was the government response worth it? Let's just say, from my perspective, I'd press X for doubt. And that, my friends, will bring our episode to a close once more. For more content like this, be sure to check back to this channel daily, Monday through Friday. Or for written articles published every day, 7 days a week, feel free to visit us at trialsitenews.com. And as always, my friends, thank you so much for joining me on the program today. From Trial Site News, I am Adrian, and I will see you all next time.